Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith-Rogers. Is autism an epidemic? Today, we're focusing on studies that count the number of children with autism. Dr. Christina Ladd-Acosta is a faculty member at the Johns Hopkins Bloomberg School of Public Health and the lead Maryland investigator on a national study about the rate of autism, the same study recently cited by HHS Secretary Robert F. Kennedy Jr. She talks with Dr. Josh Sharfstein about what this research shows and doesn't show. Let's listen.
Dr. Christina Ladd-Acosta, thank you so much for joining me today on Public Health on Call. How are you doing?
Good. Thank you for having me. I'm excited to talk to you.
Well, I am excited to talk to you because autism is in the news, including questions about how common autism is and whether the rates are increasing. And I thought, well, I know someone who studies some of these very questions. Why not have her on the podcast?
Happy to be here.
So let's start with a general question. Could you introduce yourself to our audience?
Sure. I am Dr. Christina Ladd-Acosta. I'm an associate professor in the Department of Epidemiology here at the school and also wear the hat of vice director of our Wendy Klag Center for Autism and Developmental Disabilities.
And tell me a little bit about your training and the kinds of projects that you work on.
Sure. So I really came into this school in this field with, I would say, a passion for improving women and children's health and ensuring they can really reach their full potential and lead happy, healthy lives. And so as part of that, I've really grown a research program that focuses on identifying different factors, whether they're genetic or biologic in nature, to environmental, different environments we live and work in every day, to better understand how those factors influence children's health and autism in particular.
Now, you've been doing some work lately on monitoring rates of autism. Is that a good way to describe it, or how would you describe it?
Yes, that's a good point. And as part of this work, it's really important for us to understand who in our community has autism and really what their characteristics are to better meet their needs and understand their needs. And so as part of that, I've been fortunate to be part of the Maryland ADAM team. I co-lead the Maryland ADAM site with Dr. Elise Pass, where we contribute to the overall CDC numbers that come out every 2 years on the number of kids in our communities that have been identified with autism.
I'm guessing that ADAM is an acronym?
Yes, good question. ADAM stands for the Autism and Developmental Disability Monitoring Network.
And how does that work? How do you actually come up with the numbers of kids who have autism?
So what we do here in Maryland is we work really closely with health partners and with educational partners, and we collect information from their records and review that information to determine how many children in their systems meet the criteria of having an autism diagnosis. We then, after we collect that data here in Maryland at our site, we de-identify all of that information, and those numbers get shared with the Centers for Disease Control for them to include and do an overall analysis across all the sites that are part of this ADAM network.
Tell me about the latest report. What did you find in Maryland country?
Yeah, so in the latest report, we found that 1 in 31 8-year-old children were identified with autism. Here in Maryland, our numbers were 1 in 38 children, 8-year-old children, were identified with autism. A couple other key findings that we found are we're now seeing, compared to 20 years ago, we're now seeing more children who identify as Black, Asian Pacific Islander are being identified with autism compared to those that are white. We used to think it used to be, white boys are impacted with autism, but now we see it's all of us, right? Many of our communities have children with autism in them.
And girls as well?
And girls as well. There are over now 1% of girls identified with autism.
Can you talk to me a little bit about the definition of autism? Because I think this is something that can be confusing. Sometimes when you hear the word autism, you may think of someone who is profoundly disabled. And sometimes you hear the word autism and think of somebody who has a special ability to focus on things and maybe have some differences in their social interaction. So
when we use the word autism, we're talking about individuals that have been diagnosed with what's called autism spectrum disability. In that term is this word spectrum. And it truly is a wide range of symptoms and challenges that these children and even autistic adults face and experience in their lives. You know, over the past 10 years, actually over the past 2 decades, really, there have been changes even in how we diagnose autism. And that definition has broadened to be more inclusive of some conditions that used to be kind of really specific and have specific names attached to them. They now fall under this broader autism spectrum umbrella.
what were some of those names?
So some of those, for example, would be Asperger's syndrome or pervasive developmental disabilities. And so those now, along with a number of others, are under this broader umbrella.
The umbrella of autism spectrum disorder.
Correct. And as you appropriately, pointed out, those needs are very different.
Dr. Ladd-Acosta, is the diagnosis of autism increasing in the United States?
Yes. We know the number of children identified with autism is increasing.
How much? Could you give me a sense?
We've seen over the past 20 years, I'm sure you've seen these numbers, but there has been a nearly around 300% increase. But really, if you look at any about 2-year period across the sites that are monitoring the number of children identified with autism, it's somewhere between 10 and a 20% increase every 2 years.
What do you think is explaining the increase in diagnoses?
The increase in diagnoses can be, I think, due to 2 main reasons. The first is this broadened definition of autism spectrum disorder. So we're including more people. More people are meeting this definition now than they did previously. In addition, there have been a number of, I would say, widely successful public health and practice programs where we now are doing increased screening at wellness visits for children between the ages of 18 months and 24 months of age to look for signs of autism and get them to secondary diagnostic clinics.
So it's both that what falls under autism is bigger. There are more kinds of conditions that now are diagnosed as autism, and that it's more likely that a child is going to get picked up because the doctors, nurses have been trained to spot some of the symptoms early on.
That's correct. And in addition, we think parents and caregivers and community members are also now more aware of those symptoms, and autism is being more accepted in the community. And so they're not afraid, right, to go and seek help and services and know where to get those when they have concerns.
Now, some people are expressing concern that the increase in autism diagnoses is actually because there are more kids with autism, that it's not just a question of the definition or how many people are getting screened, but that there's something driving more kids to be affected by this condition. How do you respond to that concern?
Well, we know, as we've talked about, that changes in the diagnostic criteria contributes, and that this increased screening at wellness visits and looking for it contributes. And there have been a few studies over the past 2 years that have looked at a specific subgroup of individuals on the spectrum, which we now use the term profound autism to describe. And those individuals, profound autism, need 24-hour-a-day support and care from a caregiver. They often have very limited verbal communication skills, or they have intellectual disability that co-occurs with the autism. And what the data has shown for that population is that their rates of autism have increased very minimally, if at all, over the past nearly 10 years. Although individuals that do not have this profound autism, their rates have gone up much more. And we think that higher rate in individuals that don't have this profound autism, but that might have more subtle kind of phenotypes and fewer significant co-occurring conditions, those rates have increased the most. And that is most likely due to our ability to identify these subtle traits and these subtle symptoms better in the communities.
Got it. So the kind of autism that is getting recognized more frequently is the kind of autism that you would expect to be identified because of the changing definition and because of the increased training of providers.
That's exactly right.
So we hear the phrase epidemic of autism being tossed around. Given this discussion of the epidemiology of this condition, how do you feel about that phrase?
When I hear the word epidemic, I think this true, quick, immediate increase kind of in a number of individuals that have a certain condition. We're not seeing that in autism, right? We are seeing this gradual rise over the past 20 years that is really due to broadened diagnostic definitions, better screening, increased awareness. There are still a large number of people in our community with autism, and our focus should be on, the services, getting them the services they need so that they can lead healthy lives and really reach their full potential.
Dr. Christina Ladd-Acosta, thank you so much for your work on autism, and thanks for joining me today on Public Health on Call. Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Fernandez-Cesiri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Cesiri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.